Hi, this is Dr. Bart Klika, Chief Research and Strategy Officer here at Prevent Child Abuse America, and I'm here for another installment of a monthly research review. In this research review, I look at some of the new and emerging research and position statements that have recently come out on the topic of corporal punishment, or spanking. So the first is the American Academy of Pediatrics updated policy statement on the topic of corporal punishment. This is an update to their 1998 statement. And in this updated statement, they make a much stronger case against the use of corporal punishment. In this statement, they review a lot of the updated evidence in the ineffective nature of corporal punishment. And they also review a lot of the research on the long-term negative consequences associated with corporal punishment and spanking. The American Academy of Pediatrics joins other groups such as the American Professional Society on the Abuse of Children, who have taken stances against the use of corporal punishment. Next is a research study that came out that used survey data from over 88 or nearly 88 countries to examine the association between full bans on corporal punishment, that is, bans in both the home and school setting, and partial bans on corporal punishment, that oftentimes is just bans in the school setting, and looked at the association with frequency of fighting for both male and female adolescents. What they found is that countries who had total bans on corporal punishment, so that is bans in the home setting and bans in the school setting, they found that males had less fighting, as well as females also had less fighting in those countries with full bans. What they found is that partial bans did not reduce fighting for males, but females, they did find that partial bans led to a reduction in female fighting. And then finally is a recent evaluation study of what's called no-hit zones. No-hit zones really are a universal policy that establishes zero tolerance for hitting of any kind. Oftentimes, no-hit zones are implemented in medical settings, although there have been no-hit zones implemented in congregations. For example, Prevent Child Abuse America's national board member, Reverend Darrell Armstrong, is the first to implement a no-hit zone in his congregation at Shiloh Baptist Church in Trenton, New Jersey. The goal of no-hit zones is really to promote safe and healthy environments for all by changing the norms around intervening in cases where there might be hitting, and then having staff make a commitment to intervening if they suspect or witness a child being hit, and also training staff in the skills that they need in order to intervene. In this evaluation study, they found after the implementation of no-hit zones, staff reported stronger support for intervening when parents hit their children, and more knowledge about the no-hit zone policy and how to intervene when parents hit their children. They also found that after implementation, staff reported that their coworkers, they believed that their coworkers had less support for spanking than prior to when the policy was implemented, which really speaks to a shift in a normative belief about corporal punishment and intervention. I hope you found this research review to be helpful. If you have suggestions for future research reviews, please contact me at bklika@preventchildabuse.org. Thank you.